Mr. Speaker, with permission, I'd like to make a statement on the pandemic and the roadmap to freedom. Freedom is in our sights once again, thanks to the protective wall of this country's vaccination programme and the huge advances we've made in getting this virus under control. Yesterday, I stood at this dispatch box and I set out the details of what Step 4 in our roadmap will mean for this nation. After the arduous 18 months that we've all endured, it was so wonderful to describe a world where we can no longer have to count the number of people that we're meeting, where theatres and stadiums are busting with people once again, and where care home residents are able to see their loved ones without restrictions. Now, of course, Mr. Speaker, I understand that some people are cautious about the idea of easing restrictions, but we must balance the risks. The risks of a virus that has diminished, but not defeated, against the risks of keeping these restrictions and the health, social and economic hardship that we know they bring. This pandemic is far from over, and we will continue to proceed with caution. But we're increasingly confident that our plan is working and that we can soon begin a new chapter based on the foundations of personal responsibility and common sense rather than the blunt instrument of rules and regulations. Now today, Mr. Speaker, I'd like to provide an update on another area where we'll be able to ease restrictions: the rules on self-isolation. Self-isolation has played a critical role in helping us to get this virus under control by denying the virus the human contact that it needs to spread. And I'm so grateful to the many people right across the UK who have selflessly done their duty, making sacrifices so they can help keep the virus at bay. Even though we've done everything in our power to support the people who've had to self-isolate, and yesterday we announced that we'll be extending financial support until September, I'm fully aware of how difficult it has been. But we can take hope from the fact that science has shown us a solution, just as it's done so many times in our fight against this virus. And that solution is our vaccine, which we know offers huge protection. The latest data from Public Health England shows that our vaccination programme has saved over 27,000 lives and has prevented over 7 million people from getting COVID-19. And it shows that both doses of COVID-19 vaccine can reduce symptomatic infection by almost 80%. That protective wall, because that's what it is, a protective wall, it means that the odds have shifted in our favour and we can look afresh at many of the measures that we've had to put in place. Now, this is especially important when almost two-thirds of adults, that's 64%, have had both doses of a vaccine and so have got the maximum protection that the vaccine can offer. As a result, we will soon be able to take a risk-based approach that recognises the huge benefits that the vaccines provide both to people who get the jab and to their loved ones too. So, Mr. Speaker, from the 16th of August, when even more people will have the protection of both doses and when modelling suggests the risks from the virus will be even lower, anyone who's a close contact of a positive case will no longer have to self-isolate if they have been fully vaccinated. If someone gets their second dose just before or just after the 16th of August, they'll need to wait 2 weeks, after which their second jab can take effect and give them these new freedoms. So this will allow the vaccine time to build up the maximum possible protection, those 2 weeks. Now, as we make this change, we'll be drawing on the huge capacity we've built for testing and sequencing and advising close contacts who are fully vaccinated to take a PCR test as soon as possible so they can get certainty about their condition. And of course, anyone that tests positive will have to self-isolate whether they have had the jab or not. This new approach means that we can manage the virus in a way that's proportionate to the pandemic while maintaining the freedoms that are so important to us all. As honourable members will be aware, we're not currently offering vaccines to most people under the age of 18. So we thought carefully about how we can make sure that young people get the life experiences that are so important to their development, while at the same time we're keeping them safe from this deadly virus. So in line with the approach for adults, anyone under the age of 18 who is a close contact of a positive case will no longer have to self-isolate. Instead, they'll be given advice about whether they should get tested, dependent on their age, and will need to self-isolate only if they test positive. These measures will also come into force on the 16th of August, ahead of the autumn school term. Now, I know that people will have questions, colleagues in the House will have questions about these changes and other questions around Step 4 on our roadmap and how it impacts schools and colleges. And my right honourable friend, the Education Secretary, will be updating the House immediately after my statement. We're also looking at the self-isolation rules for international travel, so that we can remove the need for fully vaccinated arrivals to isolate when they return from an amber list country. And the Transport Secretary will be providing an update to the House later this week. Mr. Speaker, step by step, jab by jab, we're replacing the temporary protection of the restrictions with the long-term protection of the vaccine, so we can restore the freedoms which we cherish and the experiences that mean so much to us all. Let's all play our part to protect ourselves and to protect others as we enter these crucial few weeks, so that in this battle between the vaccine and the virus, the vaccine will prevail. I commend this statement to the House.
Shadow Secretary of State Jonathan Ashworth.
Thank you, Mr. Speaker, and I thank the Secretary of State for advance sight of his statement. Now, this morning the Secretary of State was warning that he expects infections to hit 100,000 a day. So could he confirm if he is saying that will be the peak, and when will we hit it on his expectations? And can he confirm that with infections running at 100,000 a day, that will translate into around 5,000 people a day developing long-term chronic illness, long COVID? So what will the long COVID waiting list look like by the end of the summer? Now, he justifies allowing infections to climb by pointing to the weakened link between hospitalisations and deaths, and that we are building a protective wall. But of course, the wall is only half built. And we know from outbreaks in Israel and research that the Delta variant can be transmitted through fully vaccinated people, even if they don't get sick. And indeed, data in the last 24 hours or so from the Ministry of Health from Israel points to the Pfizer vaccine being just 64% effective at stopping symptomatic and asymptomatic transmission of the Delta variant. So sadly, being double jabbed means you are still a risk to others. And yet he's releasing controls on transmissions at the time when infections are rising, and then hospitalisations will rise as well, given we know what he's doing. So can he tell us what are the percentage of ICU beds and general and acute beds that will need to be occupied before, in his view, wider NHS care is compromised? Because we've heard him in the last week or so tell us that he wants to unlock, because he rightly wants to focus on the monumental NHS backlog. But the rising hospital admissions that are baked into the plan, into the path that he has chosen, will mean operations cancelled, treatments delayed, and waiting times increasing. So will he now be clear with patients waiting longer and at risk of permanent disability that the increase in admissions to hospital will mean that they have to wait longer, and what is his assessment of the waiting list, and what will it hit by the end of the summer? Now, I understand the rationale for his announcement today, but I've got to tell him again that the biggest barrier to an effective isolation policy hasn't been the inconvenience, but the lack of financial incentive to stay home. And if we are going to live with this virus, the days of people soldiering on when unwell are over. Sick pay is vital to infection control. Will he please now fix it? Now, getting back to normal, which we all want to do, depends on people feeling safe. Yeah. So does he appreciate that those who are immunocompromised, or for whom the vaccination is less effective, will have their freedoms curtailed by ditching masks on public transport? Blood Cancer UK yesterday warned that people with blood cancer will feel like their freedoms have been taken away when mask wearing lifts. What's his message to those with blood cancer? And it's not good enough to simply say travel or go to the shops at less busy times. Now, of course, he understands the importance of masks, because I've now read his pandemic paper from Harvard that he likes to refer to, and he praises the use of masks in this paper. But he also warns in this paper that changing course on policy making is an essential feature of good policy making. And he goes on to say, yet politicians find it hard because of the tendency for decisions to become psychologically and emotionally anchored. Well, I agree with him, and I hope he still agrees with himself as well. So let's have a U-turn on mask wearing. Yes, let's have freedom, but not a high-risk free for all. Keep masks for now, fix sick pay, and let's unlock in a safe and sustainable way.
Mr. Speaker, let me turn to the right honourable gentleman's questions. First of all, he asked about infections, and as I said yesterday from this dispatch box, that we do expect for the time being infections to continue rising for the reasons I set out yesterday. By July the 19th, the point when we enter into step 4, the advice that we receive and the modelling suggests they could be as high as 50,000, to double what they are now on a daily basis. And as the right honourable gentleman said, that beyond that, that we believe they will continue rising as the modelling goes out further. It's less certain, but they could go as high as 100,000. I've been very upfront about that. But what I've also been very clear about, the reason that we can make the decisions that we've made and set out yesterday, and the decision I just announced today on self-isolation rules for those that are double vaccinated if they come into contact with someone that is infected. The reason we can do this is because of the vaccine. The vaccine has been our wall of defence. Jab by jab, brick by brick, we have been building a defence against this virus. And the vaccine, whilst no one can say at this point that the link between cases and hospitalisation has been definitively broken, there's not enough evidence for that. What there is enough evidence for is to show us that the link between cases and hospitalisation and deaths has been severely weakened. And the honourable gentleman has asked about how many hospitalisations there have been or there may be. What I can tell him, I think will help demonstrate how this link has been severely weakened, is that at the moment we have in the last 24 hours approximately 27,000 reported new infections, and the total number of hospital in England with COVID-19, total number of people is just under 2,000. And the last time we had infections at that level, we were certainly above 20,000. And so that is a demonstration of how much the link has been weakened. And in making sure that it stays that way, we of course want to see more and more people getting vaccinated. We've announced a booster program that will start in September to make sure that immunity that comes from the vaccine remains. And the honourable gentleman also talked about non-COVID health problems, and he's right to raise that. A number of honourable members raised that, and I would like him to just try and understand that one of the reasons we have so many people that wanted to go to the NHS with non-COVID health problems, such as cancer and heart disease and mental health problems, but they were prevented, was because of the restrictions that we had in place, and how that prevented and how that impacted. Those restrictions caused many of those problems. If the honourable gentleman thinks about the mental health problems that have been caused, for example, by these restrictions. And so if we want to start dealing with those non-COVID health problems, then we have to start easing and moving away from these restrictions because of the protection the vaccine has provided us. And he, as the shadow health secretary, he should be just as concerned as I am about non-COVID health problems as he is with COVID health problems. And then the right honourable gentleman also asked me about the immunosuppressed, and again, he and and other colleagues that have raised it. They're absolutely right to raise this issue. The vaccines are there to protect everyone, and including many of those people that are immunosuppressed that can take vaccines, but also for those who can't take vaccines, the fact that the rest of us do helps protect them, and we would want to see them take the same precautions that they would usually take in winter, for example, in trying to protect themselves against colds and flus and other viruses. And also I would encourage people to make sure they're in contact with their GP to see what other measures they might be able to take, what other precautions. And then lastly, Mr. Speaker, the Honourable Gentleman asked me about masks. He referred to a paper that I authored before I took this position. But he should understand, it's a strange question for him to ask. There is a role for masks in dealing with a pandemic, in particularly when you have a pandemic with no wall of defence against that pandemic. When you have a vaccine, and when that vaccine works, and when you've got the best vaccine rollout programme in the world, then you need to start moving away from these restrictions, including on masks.
The Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. One of those other illnesses, apart from COVID, that has been very badly affected by the pandemic is cancer. And my right honourable friend will know that last year 40,000 fewer people started cancer treatment, which will sadly lead to a number of preventable deaths. So will he be looking at the workforce required to deal with the cancer backlog? Will he also look at the capital requirements of many hospitals, including in my own area, the Royal Surrey County Hospital, trying to build a cancer institute, but many of my honourable friends and honourable members will have similar stories. And can I make him a bold and generous offer to come in front of the Select Committee in September to talk about those plans? He can come for a couple of hours, but we do up to 7 hours, should he so wish.
Mr. Speaker, my right honourable friend is absolutely right to raise the issues of cancer, and of course it is a huge priority for this government. I've just mentioned, Mr. Speaker, earlier that how sadly, because of the rules that we've had in place now for well over a year, there are many people that would have come forward to the NHS with cancer or suspected cancer, and they have not been seen, and that has really built up a terrible problem, and that is an absolute priority for me to tackle with workforce, with capital, and of course I look forward to coming and sitting in front of his Select Committee. I'm not sure about the 7 hours. I'd hope he'll be a bit more lenient on me than that, but I do look forward to it.
We now go to SNP spokesperson Martin Day. Martin.
Thank you, Mr. Speaker. Given that this government has repeatedly got things wrong on COVID, from the timing of lockdowns, which allowed the Kent variant to spread, the lack of border controls, which allowed the Delta variant into the UK, the delay on red listing of India, and now we have cases of the Delta variant surging while millions of people are still to be fully vaccinated and over 1 million are already living with long COVID, many will be concerned that the UK government is actively trying to snatch defeat from the jaws of a vaccine victory. What confidence can the public have that the latest round of measures, abandoning all restrictions, is not another reckless gamble in the face of an increasing transmission? In a poll by New Scientist, a majority of disease experts said that some form of mask wearing would be required until 2022, and others thought 2023 or later was the correct time to lift mask requirements, then agreed with the government's position of ending the requirements this year. Can the Minister, for the sake of clarity and honesty, confirm that the UK government has stopped listening to the science on its COVID policy? Tragically, we have 150,000 people dead already, and the Prime Minister has said we must reconcile ourselves, sadly, to more deaths from COVID. So perhaps the Secretary can enlighten us as to how many more deaths the UK government thinks are acceptable.
Mr. Speaker, the honourable gentleman refers to the announcement we made around masks yesterday about moving away from rules and regulations to guidance and personal responsibility, and he's asking, how can we make such a decision? And the answer is the vaccine. The vaccine is working. We have more people vaccinated than any other large country in the world, thanks to the work of the NHS and the volunteers and everyone else involved, including, of course, in Scotland too. And that has weakened the link between cases, hospitalisation and deaths. And these decisions have been informed by the science. Contrary to what the Honourable Gentleman said, they've been informed by the science. The science is working.
For withdrawn, shall we go to Layla Moran? Layla.
Thank you, Mr. Speaker. The Secretary of State said in his statement that he was grateful to the many people across the UK who have selflessly done their duty. We all are. Well, last week, a friend of an NHS intensive care doctor emailed me in despair. The doctor contracted COVID-19 on Christmas Eve while doing her duty in hospital and has been unable to work since, as COVID then developed into long COVID. Now, HR have issued her with papers to file for statutory sick pay at the job centre, and she stands to lose her salary entirely. Surely this is completely unacceptable and an insult to NHS workers' sacrifices during the pandemic. Does the Secretary of State believe this is fair? I hope he doesn't. And if not, will he look into this and similar cases urgently so that the frontline staff, the heroes of this pandemic, receive the proper financial support they need while they recover?
Mr. Speaker, I'm pleased the Honourable Lady has raised this issue. First of all, my own personal thanks to the doctor in her constituency that she's just referred to, and to the many other doctors and clinicians for everything that they've done for the country and they continue to do throughout this pandemic. She's raised the issue of the particular doctor she's referred to. Obviously, I'm not aware of the details, but if she writes to me, I would certainly respond to her and look at it carefully.
David Green.
Thank you, Mr. Speaker. We all recognise that the tremendous success of the vaccine programme has changed everything, and my right honourable friend has made that point eloquently again this morning. But it's also clear from the recent daily figures that take-up appears to be falling. Can my right honourable friend explain why that's happening and what he's doing to make sure that as many people get vaccinated fully as fast as possible?
Yeah, Mr. Speaker, what I can tell my right honourable friend is that, first of all, in terms of take-up, compared to any other large country, it's the best in the world. That said, we of course would like to see even better take-up. At the moment, 4/5 of adults have had at least one jab, and 3/5 have had 2 jabs. We are seeing many vaccine centres move into sort of walk-in vaccine centres. I visited the one at St Thomas's myself just last week, and that has certainly encouraged more people to come forward. And also, yesterday I announced that we are shortening the gap between the first dose and the second dose for all under 40s to 8 weeks, and I think that will help as well. So we continue to push take-up, but every time this is raised in Parliament, it's a good thing. There's an opportunity for all of us as parliamentarians to ask our constituents to come forward, take up the vaccine, and help build that wall of defence.
Mr. Speaker, I thank the Secretary of State for his statement today and for all that he and his staff in the NHS have done on behalf of us all. I recognise, as the Secretary of State has said, that there must be a risk-free approach in place and welcome that. But can the Secretary of State outline what steps his department are taking to meet the psychological needs of young people with cancer to ensure that they can access timely, high-quality support regardless of the COVID statistics and variants which has seen their treatment delayed, causing additional mental health strain? Thank you.
Mr. Speaker, the Honourable Gentleman is right to point out that there's no risk-free way forward. The whole world with this pandemic, it's unprecedented, and leaders across the world are having to balance up risks and take the approach that they think is right. And he's also right to raise the challenges created by this pandemic and our response to it that are not directly linked to COVID itself. The mental health increase that we've seen across the nation, including in Northern Ireland. We have provided much more funding for mental health, but we do need a long-term sustainable plan to deal with mental health challenges that have sadly increased.
Dr. Andrew Mercer.
Thank you, Mr. Speaker. I very much welcome the statement of my right honourable friend to his place. It emerges that AstraZeneca vaccine made in India, particularly batches 4120, Z0012 and 3, may not be recognised by the European Medicines Agency, despite of course being recognised by the MHRA. That has implications for the digital COVID certificate that will enable many constituents to be able to travel to Europe this summer. Can the Secretary of State clarify negotiations with Europe about this, and also say whether regulatory bodies in other jurisdictions, notably the FDA, are taking a similar line as the EMA is?
Mr. Speaker, what I can tell my honourable friend is that the AstraZeneca type vaccine being used in India is, I think it's referred to as Covishield. We have not used Covishield in the UK, and we are in intensive discussions with our European friends to make sure that they have the facts on hand and they can respond accordingly.
Let's go to Debbie Abrahams. Debbie.
Mr. Speaker, today's Health Foundation COVID report adds to evidence from Professor Sir Michael Marmot on the UK's high and unequal COVID death toll. It shows that the UK has not only suffered high levels of COVID mortality, the second highest excess deaths for working age people in Europe, but that people of colour and disabled people were 5 and 6 times respectively more likely to die than their white counterparts, as well as non-disabled counterparts. On top of this, those in poverty were nearly 4 times more likely to die from COVID than more affluent groups. So following my question to the Health Secretary yesterday, when I asked, is the government committed to levelling up or not, I'm asking when will they implement the Sir Michael Marmot's and the Health Foundation's recommendation to address these inequalities and build back fairer?
Mr. Speaker, I am looking closely at those recommendations. I want to look at the expert advice of everyone out there that's providing good, sensible advice about how we can come together and tackle this pandemic. And the Honourable Lady is right to point out that the pandemic, sadly, has been disproportionate in certain communities and its impact, including, sadly, with disabled people, people from ethnic minorities. That's true not just in the UK, I think it's true across the world. And we do need to work out a plan to deal with that, and also in the future, if there was ever a future pandemic, to make sure that we've learnt the lessons.
Thank you, Mr. Speaker. Clearly, our protection against further waves of the virus depends on uptake of the vaccines. Will my right honourable friend look at how the daily infection, admission and death statistics can be broken down by age group and by vaccination status so that everybody can see the benefits of vaccination for themselves and for others?
Yes, Mr. Speaker, the vaccines are our wall of protection. That is what is allowing us to make the decisions that we have to restore our freedoms and continue down that road. And I think providing more information, more detail on the take-up, especially by age group and locality, can be helpful.
Let's go to Tulip Sadiq. Tulip.
Thank you, Mr. Speaker. The flu season we've just been through was the mildest on record, thanks in no small part to the fact that we've all been wearing masks to protect against coronavirus. Public Health England has warned that we could see a flu surge in winter as we haven't had much recent exposure and therefore immunity to other respiratory viruses. What is the Secretary of State doing to prepare for this? And does he agree that we should keep masks compulsory in public transport to keep COVID cases down and prepare for flu season?
Mr. Speaker, I think the policy on masks is the one we set out yesterday is the right policy, but the Honourable Lady is right to raise the concerns around flu this coming winter for all the reasons that she said. She asked what we're doing about it. Well, one of the things that we are doing about it, and by no means all, is that when we recently announced that we plan to have a COVID vaccine booster program in September, starting with the more vulnerable cohorts, our plan, based on the advice of JCVI, is also simultaneously offer the flu vaccine, which will mean that the take-up of the flu vaccine should be at record highs.
Thank you, Mr. Speaker, and can I welcome my right honourable friend's statement. One of the things that I get contacted by in an increasing number is access to GP appointments, with many constituents still struggling to go and see their GP face to face, and we know the impact that will have on early diagnosis and treating other illnesses. So could I ask what steps the department is taking to encourage and support GPs see patients face to face, which will help address many of those other challenges?
Yes, Mr. Speaker. It is essential, as my honourable friend says, that we get GP access back to normal. I think we can all understand why, during this pandemic, GPs have had to also do other jobs like help us get the vaccines, that they haven't been available in the normal way because of social distancing rules and other reasons. But I think gradually we are starting to see things going back towards normal. I think the changes that were announced yesterday will help with that. But also, as the vaccine program, which will continue for a while as we set out, as that settles down and we get more people dedicated to that, we can release GPs from some of those duties, and I think all of that put together will help.
Thank you, Mr. Speaker. The Secretary of State has already acknowledged the importance of dealing with the mental health problems that we've seen arising in this pandemic. And it's now urgent that that's addressed. So when will the government publish a clear statement on where Public Health England's vital public mental health and suicide prevention role fit? Where will it sit in the new arrangements for our national public health system?
Mr. Speaker, the honourable lady is absolutely right to draw attention to this. One of the worst outcomes of all the restrictions we've necessarily had to have during the pandemic is there's been a significant rise in depression and many other public health problems, and we do need to start making that much more of a priority and tackling that now that we can move past what I hope is the worst of this pandemic. And I do want to come forward as quickly as I can with a new plan on mental health to set out what more we can do, both to clear the sort of backlog of cases, as it were, because we do need to put more effort and resources into that, but also looking forward about what more we can do, both through investment in skills, but also investment in capital.
Dr. Jamie Wallace. Jamie.
Thank you, Mr. Speaker. Can I thank my right honourable friend for this statement? Many constituents are asking me about the role booster vaccines will have in ensuring we don't have to go back into lockdown at a future date. Does my right honourable friend agree that providing additional booster jabs to the most vulnerable and all those over 50 will strengthen the protection gains made by our current vaccine programme?
Yes, Mr. Speaker, I do agree with my honourable friend. The vaccine programme, that is our wall of protection, and every jab is building that wall higher. And as immunity wears off, we do need to make sure that people get a boost of that with a third jab. And as we've announced, that programme of boosting will begin with the most vulnerable cohorts in September.
Thank you, Mr. Speaker, and thank you for your indulgence allowing me to acknowledge the passing of Father Sam Swami from COVID last night. He is a humanitarian Jesuit priest who has been held in custody in India since October of last year, and I hope the House will join me in expressing our condolences to all who knew him. With regards to the statement today, there's a fundamental weakness to the Secretary of State's comments. The COVID virus did not get the memo and has not read his statement. And whilst vaccines are really important, if he wants to build a ring of defence around the continued spread of this virus, then surveillance is absolutely key. Last week I was promised evidence from Porton Down supporting the continued use of intravenous flow devices across the country. That information has not been passed to me. I also asked for the MHRA's letter recommending the extension of the exceptional usage authorisation. Again, that has not been forthcoming. When can I expect to receive this very important information?
Mr. Speaker, can I first associate myself with the honourable gentleman's expression of condolences, and turning to his substantive question, I'm not fully aware of the information that he has requested, so I have noted it now and I will look into it and write to him.
Let's go to Gagan Mahindra. Gagan.
Thank you, Mr. Speaker. Can I welcome the statement from the Secretary of State and take this opportunity to welcome him to his place? Does my right honourable friend agree that the UK's portfolio of 517 million vaccine doses is evidence of the world-leading effort of this Conservative government in securing our route out of this pandemic, allowing restrictions to be lifted?
Mr. Speaker, I agree absolutely with my honourable friend. I think it is fair to say our effort on vaccines as a country has been world leading. It is the best certainly in Europe in terms of number of people that have received the vaccine. It is the biggest and largest of any of the large countries, and that is down to the efforts of so many people, especially the scientists, the vaccine task force, and all the NHS workers, the doctors, the nurses, the volunteers, and it is a group effort, and it is something I think when we look back ultimately at this pandemic will be one of the things that we will know has saved so many lives.
Thank you, Mr. Speaker. Some experts are warning that easing COVID restrictions too quickly could contribute to the emergence of a new, more dangerous variant which may well be resistant to the vaccine. Can the Secretary of State inform the House of any contingency planning by his department or the UK Government about how the UK Government will cope in the event of such an alarming eventuality?
Mr. Speaker, the Honourable Lady is right to raise the risk that absolutely exists. This pandemic is not over of new variants. We've seen the impact of variants already, and no one knows what's going to happen. And of course, reasonable experts will have different views on this. In terms of the measures that we're taking, I'll point to a couple. We are keeping border controls in place. Yes, we are making some proportionate and balanced changes, but border controls are staying in place. We are keeping the test, track and isolate policy in place. Again, some sensible changes being made, but through that policy and the huge amount of tests that will still be done with our genome sequencing program being the best in the world, the largest in the world, it will allow us to detect any changes in the virus sooner than perhaps other countries. And then lastly, the team, both in my department, in Public Health England, the Chief Medical Officer, they're very much aware of this issue. It's not just an issue for us about new variants, it's an issue around the world, and we'll continue to work with our international partners.
Let's go to Henry Smith. Henry.
Thank you very much, Mr. Speaker. The UK's world-leading COVID-19 vaccination programme has been phenomenal, but unfortunately there are some immunosuppressed and immunocompromised, such as people with blood cancer, for whom the efficacy of the vaccine isn't nearly as effective. Can I have a commitment from my right honourable friend, the Health Secretary, that those who fall into that category will be properly informed and advised by the NHS as to how to protect themselves better?
Yes, Mr. Speaker, I can give my honourable friend that assurance, and he's absolutely right to raise this. And as we go forward with our plans and develop those plans, we are absolutely thinking about all those more vulnerable cohorts and the impact that it may have on them. And that is why when we set out the details of Step 4 regarding those that are immunosuppressed, there will be new guidance, and it will be something that GPs can use in working with those patients.
Thank you very much, Mr. Speaker. It's clear from comments made by the Chief Medical Officer, the Prime Minister and the Secretary of State over the last 24 hours that it is their view that it is better to have a third wave of COVID now than it is in the winter when the NHS is struggling. So could the Secretary of State please confirm explicitly whether that is the policy aim of the government? And if so, could he confirm how many excess deaths and additional cases of long COVID officials estimate that third wave will result in?
Mr. Speaker, no one wants another wave of COVID cases, and as the Honourable Lady would have heard, what is different this time, as we do see, sadly, cases rise, is the vaccine. The link between the case numbers and hospitalisation numbers has been severely weakened, as I've set out in the House, to the House in quite some detail, and that is what matters.
So, David.
I welcome my right honourable friend's appointment as Health Secretary and his sensible statement today further easing restrictions. But following on from previous points of colleagues, would my right honourable friend confirm to Southend residents that the booster vaccine will be available this winter and that enough centres will remain open to efficiently administer it?
Mr. Speaker, I'm very happy to confirm that to my right honourable friend that the booster programme, which will start in September, we still have to get the final advice from JCVI on exactly how it's going to work, but it will be throughout the United Kingdom, and that of course includes his constituents in Southend.
Catherine West.
Speaker, parents in my constituency have been in touch regarding ventilation in their children's school. What advice will health officials give to the DfE about putting ventilation into schools and paying for extra measures, which might mean that children can stay in school longer without the fear of transmission of COVID, and that staff will be protected as well?
Mr. Speaker, another very good question, and the Education Secretary will be speaking right after me about some of the changes that we're making and how it will affect schools and school settings. And when it comes to ventilation, there has been, during the course of this pandemic, more funding to schools to make certain adjustments, and I think that kind of support will continue, but also I think some of the measures that we're announcing today will help with schools and school children.
Thank you, Mr. Speaker. May I start by welcoming my right honourable friend's statement. Earlier today I spoke with the fantastic Chief Executive of one of our local NHS trusts in Stoke-on-Trent, Tracy Bullock, who oversees the Royal Stoke University Hospital. Tracy's told me there has been a significant increase in emergency department attendances above those usually seen in winter. So can my right honourable friend outline what additional resources can be given to help our NHS get on top of this, because winter is coming?
Mr. Speaker, my honourable friend will know that the reason that across the country we've seen an increase in demand for A&E is because many people haven't been able to go forward to their GPs in the usual way, and quite understandably, when a problem they have gets to a point which in normal circumstances it should not have had to reach, they go to A&E, and that is what I mean, Mr. Speaker, when I talked earlier at this dispatch box about the backlog of cases. I've mentioned yesterday we believe that some 7 million people that would have in normal circumstances come forward to the NHS either through their GP or otherwise, that did not because of the rules and restrictions around the pandemic, and now as we ease those restrictions, that's going to make a big difference.
Let's go to Florence Eshalomi. Florence.
Thank you, Mr. Speaker. Over a quarter of my Vauxhall constituents are aged between 20 and 29, and many of them have not had a chance to come forward for their second vaccine, and obviously this lockdown will ease again in 2 weeks' time. The Secretary of State has this morning confirmed that numbers are expected to go after July the 19th, and he will be aware that it's still the case that a number of young people, 1 in 8, are still vaccine hesitancy. We know that there's no link between cases and hospitalisation, and that link isn't breaking, and young people are fearful of getting long COVID. Can the Minister inform the House what specific resources are being made available through the NHS for those suffering with long COVID?
Well, Mr. Speaker, I mean, first of all, throughout this pandemic, the government has made, I think, over £90 billion more available to deal with the consequences of the pandemic, and much of that has gone to the NHS and to other parts of the healthcare system, and that is helping in every aspect, but including with those sadly suffering with long COVID. In terms of younger people, the Honourable Lady will know that first of all, younger people are less affected. They are affected, of course, by this virus. No one can pretend otherwise, but they're less affected, less impacted by older people in their communities, and that's why that's been the priority in vaccination programs. But now, with the July 19th date, one of the reasons that date was set is that it allows everyone, every adult, to get their first jab, and also the reason I announced the decision yesterday, which was to shorten the time period from 12 weeks to 8 weeks between jabs, was that some more people, including all the younger people that she's referred to, can get the full protection of a double dose by September.
Stephen Hammond.
Thank you, Mr. Speaker. Can I thank my right honourable friend for his statement today? And he will obviously know there is the normal winter preparedness programme just about to start. Could he confirm whether or not he will examine the medical evidence for vaccinating people under the age of 18 as part of this year's programme, and what extra measures he might be putting in place with social care and discharge, so that the beds that normally increase, the pressure on beds normally increases, will be taken care of this winter?
Yes. Mr. Speaker, my honourable friend is absolutely right to raise the normal pressure that comes in winter, and as we look at this winter, because of the measures that we had for the pandemic, it does mean there's less immunity for flu and other viruses that tend to come around in winter, and so we are actively making plans for that. There were plans already in the department when I arrived, and I'm reviewing those plans, and it's something that will be a priority.
Matt Weston.
Thank you, Mr. Speaker. The Secretary of State quite rightly last week stated that he was looking at the numbers very carefully immediately after being appointed. He'll have looked at Japan and Korea, no doubt. Well, you've seen that the death rates are something like 2% or 5% of the UK death rate. Case rates are currently 8 or 9 per 100,000 in Korea and Japan. Yet they are still wearing masks, mandating to wear masks, certainly in Korea. What does the Secretary of State think, in the light of that, we should be doing? Because clearly they're having success.
Mr. Speaker, we all know that the impact of this terrible virus has been very different across the world. The honourable gentleman has talked about countries in the Far East. The impact if you look at in South America or India or in Europe, it's very different. And I don't think you can simply draw a conclusion that the reason for that difference is the policy on masks. The reason why, the primary reason we were able to announce what we did yesterday in terms of the step 4 measures is the vaccine. And if the honourable gentleman looks at the countries he mentioned, particularly Japan, he'll see that their vaccination rates are a lot lower than the rates that we have, and that will partly explain why they may be taking a different approach in how they're tackling the vaccine, the pandemic at this point.
Thank you, Mr. Speaker. Can I congratulate my right honourable friend on his new role, and I warmly welcome his statements about the importance of addressing non-COVID health issues. Sadly, for the last 17 months, our children have been not seen and not heard, and I know from my own children and those of my constituents the devastating impact that lockdowns have had on the well-being of our children and young people. So can my right honourable friend set out what measures he is taking as we return to normal to focus on the physical and mental health of our young people and make sure that the anxiety and the physical inactivity of the pandemic is not leaving permanent scars?
My honourable friend is absolutely right to raise this, Mr. Speaker, and sadly, because of the necessary measures that we've had to take, the impact on children has been immense in the negative ways that she's just set out. And she will know, just from my own research that I did before coming back into government, we've seen, for example, a huge rise in reports of child abuse. And the reporting, for example, to the NSPCC's Childline has rocketed during the course of the pandemic, and that is a direct cause of children not being in school, not having enough people to report that kind of activity to, and so we need to absolutely respond to that. And in terms of the measures, what I hope and what I know, and the Education Secretary will have more to say about this in a moment, the measures that we've already announced between yesterday and the measures today, I think will make a dramatic difference to children's well-being.
Let's go to Charlotte Littles. Charlotte.
Thank you, Mr. Speaker. The pandemic is not over, and learning to live with the virus means putting in place measures to reduce risk. Flamefast, based in Woolston Grange in Warrington North, manufactures CO2 monitors, which alongside measures such as air filtration and improved ventilation can help to dramatically reduce the risk of indoor transmission of the virus. So why has the Secretary of State ignored calls from the Labour Party to put in place measures such as air filtration, improved ventilation and CO2 monitoring to reduce the risk in indoor confined spaces, particularly in hospitals and care homes for the most vulnerable in our communities, which could help to save lives and to give a vital boost to our manufacturing sectors?
Mr. Speaker, I think it's not right for the Honourable Lady to suggest that the government has ignored the need to combat this virus with better air filtration, with better ventilation. A lot of the funding the government has provided during the course of this pandemic, so for example, extra funding to care home providers, has been there precisely to introduce and help fund some of these measures.
Thank you, Mr. Speaker, and I welcome my right honourable friend to his new place. I know that he will share the view of many of my constituents in West Berkshire that we must do all we can to avoid another national lockdown. In the event that the vaccine efficacy should falter as we head into the winter months, say because of a new variant, could he set out what extra steps his department is taking to ensure that this winter won't be a repeat of last?
Mr. Speaker, what I can tell my honourable friend is that one of the measures, just one that we are taking, is that we do have, so we have a huge number of tests that take place, over 500,000 a day, and that does give us a certain insight into how this virus is changing, if it is. And the genome sequencing resources that we have are the best in the world. We do almost half of the genome sequencing in the world, and that is fed directly to our scientists and our world-leading vaccine program and taken into account as we develop new vaccines. And the Honourable Lady knows about the booster program. I think the booster program will continue into next year, and who knows how long, but every time we have a booster, we will be doing everything we can to take into account changes in the virus itself.
Let's go to Sir Tony Lloyd. Tony.
And thank you, Mr. Speaker. The Health Secretary has already referred to the pressures on our GPs and our hospitals from non-COVID patients, and that, of course, is real. Most health professionals, doctors, nurses and others, have been double jabbed and regularly use at least the lateral flow test to ensure that they're not infected with COVID. But one of the local hospitals that affects my constituency, Fairfield, tells me that there are something like 30% of doctors who were not available recently because they'd been pinged, they'd come into contact, not surprisingly, with somebody with COVID. Not because they found they were infected, but because they then had to go and quarantine for that 10-day period. We do risk, Mr. Speaker, a build-up of cases which will increase the number of times our medical professionals like to find themselves pinged. Could the Secretary of State have a look at this and see if there's some way, at least for medical staff, of bringing forward that August date?
Mr. Speaker, the right honourable gentleman has raised this issue of understanding people that are pinged, so to speak, that if, by having come into contact with an infected person, they do have to self-isolate. The announcement that I've made today will clearly make a huge difference to everyone that is pinged in such a way, including all those fantastic people that work in our health service, the doctors, the nurses and others. And as I've said, it will come into force from August the 16th. We did think carefully about whether we could do it earlier than that, and it's a fair question, but the reason we decided not to was based on the best public health advice was that by August the 16th there'll be many more people, even more than now, that are double jabbed, and that extra layer of protection makes us more comfortable to stick to this August the 16th date.
Thank you, Mr. Speaker. I welcome the Secretary of State's statement. Primary care has shouldered the brunt of the vaccine deployment, and many GP surgeries in Stoke-on-Trent South are not yet back at full capacity with general appointments. A number of my constituents have raised the difficulties of getting to see their GP, so will my right honourable friend do all he can to ensure primary care services are able to fully recover?
Well said.
Yes, absolutely, Mr. Speaker. I can give my honourable friend that assurance, as well as the extra resources we're putting in. Even if you think about the measures that I've announced today about self-isolation and no need to self-isolate if you have if you've been in contact with an infected person but been double vaccinated, that will help across the board, and certainly that includes our NHS and our primary care providers.
I now suspend in the House for 3 minutes to enable necessary arrangements to be made for the next business. Order.
Order! I call Secretary of State Gavin Williamson to make a statement.
With permission, Madam Deputy Speaker, I'd like to make a statement regarding restrictions that will be lifted for schools, early years, childcare, colleges and universities when we move to Step 4, which is currently anticipated as the 19th of July. The Prime Minister announces that Step 4 will be able to remove swathes of restrictions on daily life, and that after 16 months of sacrifice by those across society, we will return ever closer to normality. We have faced down together a historic public health emergency, and that we all owe a great debt of gratitude to pupils, parents and teachers who have given up so much as we have taken action to save lives. I do, however, want to highlight to everyone that Step 4 does not mean the end of a pandemic, and some restrictions will be kept in place while we move towards more of a population being fully vaccinated. While the pandemic is not over, we are moving into a new phase of managing COVID from strict rules and towards ever more greater personal responsibility. When I came to this place last week, I again set out my priority to put the interests of children first. We know from our own experience and evidence that children are better off in classrooms with their friends and teachers. Millions of children and young people have been back in the classroom since March the 8th, learning with their friends and teachers. This is hugely valuable for their well-being as well as for their education. I also made clear that I do not think that it is acceptable that children should face greater restrictions over and above those of wider society, especially since they have given up so much to keep older generations safe during this pandemic. So, having balanced the risks, I'm pleased to tell members across the House that key restrictions on education and childcare will come to an end as we move to Step 4. Though keeping children in consistent groups was essential to control the spread of the virus when our population was less vaccinated, we recognise that the system of bubbles and isolation is causing disruption to many children's education. That is why we'll be ending bubbles and transferring contact tracing to the NHS test and trace system for early years settings, schools and colleges. Where there are outbreaks, schools and colleges may be contacted by NHS test and trace, and they will also work with local health teams as they currently do now. We're also setting out new rules that mean that from the 16th of August, children will only need to isolate if they have tested positive for COVID-19. I'm also pleased to be able to say there will be no restrictions on in-person teaching and learning in universities unless students are advised to isolate or impacted by local outbreaks. From Step 4, a more proportionate set of controls will apply in early years, schools, colleges and higher education institutions. These will maintain a baseline of protective measures in education settings while maximising attendance and minimising disruption to children and young people's education. In addition to ending bubbles, it will not be necessary to stagger start and finish times. Schools and colleges may of course continue with these measures until the end of the summer term if they so wish. My right honourable friend, the Health Secretary, outlined earlier today that we can ease restrictions on the rules of self-isolation for close contacts of someone who has tested positive for COVID-19. In education settings, all other existing measures, including guidance on isolation of contacts, will stay in place until the end of this term, in line with isolation rules for the rest of the population, as more adults are vaccinated. Settings will continue to have a role in working with health protection teams in the case of a local outbreak. Where necessary, some measures may need to be reintroduced. From August the 16th, those under the age of 18 years old will no longer be required to self-isolate if they are contacted by NHS Test and Trace as a close contact of a positive COVID-19 case. This will balance the need to keep children safe at the same time as allowing them to get the education that they deserve and need. Instead, children will be contacted by Test and Trace, informed they have been in close contact with a positive case, and advised to take a PCR test. 18-year-olds will be treated in the same way as children until 4 months after their 18th birthday to allow them to have the opportunity to get fully vaccinated. Having listened to teachers and balancing the risks to health and education, to maximise attendance and minimise disruption to children and young people's education, some protective measures, including enhanced hygiene and ventilation, will remain in place for the autumn term. From step 4, face coverings will no longer be advised for pupils, students, staff and visitors, either in classrooms or in communal areas, and social distancing will no longer be necessary. As I mentioned earlier, testing programmes remain important as we move cautiously out of restrictions. With this in mind, secondary schools and colleges will be asked to provide 2 on-site tests to their students at the start of term, with regular home testing continuing until the end of September, when this will be reviewed. It is vital that secondary school and college students continue to test for the last few weeks of this term and throughout September. Education settings were still operating over the summer will continue to test twice a week, with asymptomatic test kits still available to families over the summer break as well. I also want to encourage all teachers, educational staff and eligible students to get their vaccines. It is incredibly important for all staff to get the second dose of a vaccine as soon as they are eligible, so they secure the strongest possible protection against COVID-19. In line with wider changes to isolation from August the 16th, if in close contact with someone who has tested positive, fully vaccinated teachers will be able to remain in the classroom from the autumn term. My department has just set out more detail and published new guidance for arrangements in education settings from step 4, covering both a summer period and the following term when children will return to school. I want to take this opportunity to assure members that head teachers in their constituencies can contact the Department of Education if they have any questions about the new guidance that we have published. Madam Deputy Speaker, no government would want to restrict people's freedom in the way we have had to since the spread of COVID-19. We have prioritised education since the start of this pandemic. We made sure that schools and colleges were the last to close, but the first to open. We kept school and college places open to vulnerable children and those of key workers throughout the pandemic, and procured millions of laptops and tablets for children to learn at home. None of this could have been achieved without the incredible work of our inspirational teachers and wider educational staff. And I'd like to thank the parents and students who have shown patience and flexibility over the last 18 months. Madam Deputy Speaker, I know that many colleagues will agree that today, as a nation, we prize the role of schools, colleges and universities more than ever before. With the ending of these restrictions, children and young people will be able to get back on with their education and lives while we continue to manage this pandemic. I commend the statement to the House.
Thank you. We now go to the Shadow Secretary of State, Kate Green.
Thank you, Madam Deputy Speaker, and I thank the Secretary of State for his statement and for advance sight of it. I'd also like to echo his tribute to the education staff, pupils and parents who've done so much over the past 15 months to keep children and young people learning. Just over an hour ago, the Department for Education confirmed that last week 623,000 pupils were not in school because of coronavirus. And while 471,000 of those pupils were out of class because of a bubble collapsing, there were still over 150,000 who were not in the classroom with confirmed or suspected cases of coronavirus or because of potential contact with a case outside the classroom. It's not just bubbles that have driven pupils from the classroom, it's the Conservatives' negligence in letting the Delta variant take hold at the same time as they failed to support schools with the necessary precautions. I've always said that school is the best place for children, for their learning, their well-being and their development, and that's why we must do everything we can to keep them there safely. Many parents will be relieved to hear that the chaotic bubbles policy is coming to an end, but the Secretary of State hasn't given us confidence that his alternative will keep more children in school without driving up infections. His department has piloted using testing instead of the bubble system, but he didn't mention this in his statement. Can he tell us the results of those pilots and using daily testing in some schools? Did it mean more hours in the classroom? Did it mean more cases? Did it mean an unmanageable workload for school leaders? Can he confirm how many schools pulled out of the pilots? And if the reasons for schools' withdrawal is informing his department's planning for next year? He said bubbles will end when we reach stage 4. But that there won't be any on-site testing until September. So what support is he putting in place to keep pupils in the classroom for the remainder of this term? He said bubbles need to end in order to support summer schools. Can he confirm that they will have mitigations in place in addition to testing so that children can learn and not just isolate over the summer? And separate to summer schools, his department has promised a holiday activities and food programme. Can you tell me what measures will be in place to ensure this programme can run so that children don't miss out on the opportunities it offers? The Secretary of State spoke of a baseline of protective measures when schools return in September. Can he say more about what they are? He mentioned better ventilation. Will all schools receive support from his department to put this in place? And specifically on masks, can he explain to me why masks were required in schools in March and April, but aren't required now when case numbers are much higher? Will he publish the scientific evidence that I'm sure he's received to underpin his decision? And if he can't do that, will he reconsider it? We know that the vaccination programme delivered by the NHS remains our route out of the pandemic, but we still don't know if it will be available to children. When does he expect to receive this advice? And when will he make it public? If the JCVI do propose vaccinating older children, can he guarantee that the infrastructure will be in place to begin that process before the return to the classroom in September? And as we look ahead to the new academic year, can he guarantee that schools, staff and pupils will know his plans for assessments next year by the 1st of September at the latest? The Secretary of State mentioned on-site testing in colleges, but what other measures will be in place? Have they been supported, for example, to implement better ventilation? I'm sure students will welcome the return of in-person teaching and learning in higher education, but can the Secretary of State say what protective measures will be in place in these settings and what steps will be taken to support the return and safe learning of international students? Madam Deputy Speaker, I want nothing more than for children to be in class, learning and spending time with their friends and their teachers. And it's right for their learning that we move away from the chaotic bubbles system. But we can't simply wish away the real challenges of the pandemic. Today's statement offers no clarity on how the government will stop infections spiralling, the Conservatives' inadequate testing regime, lack of action on ventilation, and their reckless at the border have put our children's education at risk. This must not continue.
Secretary of State.
Well, thank you, Madam Deputy Speaker. The Honourable Lady touched on a number of areas there. In terms of universities, we of course are always supporting universities in terms of international students, but also supporting them to get back to face-to-face teaching, welcoming youngsters back into the lecture theatre, which is, I know, something and part of the university experience that so many students have dearly, dearly missed. The Honourable Lady does seem to have missed probably actually the biggest point and the biggest thing that has actually changed over the past few months. And I do appreciate that the Honourable Lady is probably wedded, Madam Deputy Speaker, to the European Union vaccine programme, and she probably feels a sense of disappointment that actually this country decided to go out on its own and actually procure our vaccines. But the biggest difference is that actually in this country we've seen over 80 million vaccines already delivered into people's arms, giving them more protection, and so much more protection today, Madam Deputy Speaker, than we actually had back in March and April of this year, as this incredibly successful programme that has been led by the Prime Minister has had a real impact in terms of saving lives, keeping hospitalisation down, and ensuring that we can take these important steps back to normality, and both adults and, most importantly, children can get back on with their lives.
Robert Halford.
Thank you, Madam Deputy Speaker. I strongly welcome this government announcement today, and I thank my right honourable friend. We need to keep our children in school, not out of them. We know that in secondary schools, COVID-related absence was 10.4%, up from 6.2% on the 24th of June. And other analysis suggests that on an average year, 10 pupils due to sit GCSEs next summer have missed 1 in 4 days of face-to-face teaching this year. So what assessment has the government made of the impact on children not at school in exam years, and what remedial action are they going to take to ensure that there's a level playing field for these children who've missed so much school, they have a level playing field for next year's exams?
I know my right honourable friend raises a very important issue, and something that is, of course, concern to teachers, parents, but most of all pupils who will be looking towards 2022 and assessment and awarding of grades. It is our intention to move back to an exam system, but we do recognise that we need to ensure that there are mitigations that are put in place for pupils who will be taking that assessment in the next academic year. We will be looking at sharing more information as to what those mitigations are before the summer, and we'll obviously update his committee and the House accordingly.
We now go by video link to Vicky Foxcroft.
Thank you, Madam Deputy Speaker. And many young people are extremely worried about next year's exams. And one young constituency recently told me, "I have never felt less confident in my ability to take part in next year's exams, if there even is that opportunity. And I'm sure many others are struggling. I ask for 2022 GCSE exams to be simpler, easier, and adapted to our lack of necessary education out of compassion." What does the Minister say to them, and when will schools get certainty about changes to next year's exams and assessments?
I think the Honourable Lady may not have heard the answer to my right honourable friend, the member for Harlow's question, but what we did say to my right honourable friend is that we'll be looking at giving further guidance and information to schools imminently, and we are very much looking at what are the measures to put mitigations there, but recognising the best form of assessment is always examination.
Sir Edward Lee.
Thank you for putting children first. In the last year, the education of children has been trashed. Now, whilst every death of a child is tragic, we have to understand there are 12.7 million children in this country, and sadly, every year 6,000 die. So can we have a sense of proportion? Will the Secretary of State reassure parents that the chances of any child falling seriously ill from COVID are, quote, vanishingly small, and there is no risk to children by what he's announced today?
My right honourable friend is right to point out how, as Professor Chris Whitty has pointed out so many times, that children have very little adverse effects of COVID on them if they're unfortunate enough to get it. And this is why we think that the steps that we have outlined today, combined with the vaccination programme that we are rolling out right across the country, means that it is right to take this next cautious but important step forward in light of the scientific, medical and health evidence.
Munira Wilson.
Thank you very much, Mr. Speaker. Today's announcement about the scrapping of bubbles and self-isolation for pupils will be welcome news to many parents, pupils and teachers across the country. But he made very passing reference to the importance of ventilation, and we know now how we know about the importance of ventilation because it's an airborne virus. Therefore, what more is he doing to support schools to put better ventilation in place? I visited Richmond upon Thames School in my constituency yesterday. They've spent £15,000 alone on improving ventilation. Many schools simply can't do that. They're struggling to balance the books already. So what more support will he put in place and follow the example of Germany and New York City?
Well, Madam Deputy Speaker, at every stage during this pandemic, we've provided support for schools as part of their measures that they've needed to put in place in order to be able to restrict the transmission of COVID and ensure that they're able to be open. We recognise that good hand sanitisation and good hygiene along with ventilation are important. We continue to offer advice to schools as to how best to deliver that.
Alexander Stafford.
Thank you, Madam Deputy Speaker. Digital inclusion is a huge issue for pupils across Rother Valley. However, both the government and local businesses such as AES Seal have stepped in to eliminate this barrier. AES Seal has provided computers for over 1,500 households across Rotherham, and this government has provided 1.3 million laptops and tablets to disadvantaged students during the pandemic across the country. Can my right honourable friend confirm that pupils will continue to benefit from this record investment in IT equipment?
Secretary of State.
Well, Madam Deputy Speaker, my honourable friend not only highlights the amazing work that we've seen in terms of distribution of laptops by the government right across the country, but the wonderful work of local businesses such as AES Seal, who have gone out of their way to support their communities, help children and make a real difference. And that really does show about how communities have come together to be able to support not just the elderly but also our children. It's a great testament, and I very much hope that the investment that AES Seal but also the government has made in terms of laptops and education technology will have a long and lasting legacy in terms of bettering people's education, not only in my honourable friend's constituency but in every one of our constituencies.
Christian Matheson.
Madam Deputy Speaker, can I press the Secretary of State on the question of exams that other honourable and right honourable members have mentioned? My constituent Ian is a teacher who points out that every time there have been changes to the exam system in the last couple of years to cope with the pandemic, it's been at last minute with very little time for schools and pupils to prepare. If the Secretary of State is considering changes to the exam system, can he have an open consultation with school leaders and teachers and get the plans in place as early as possible so that there isn't this sense of teachers being dumped upon at the last minute?
Well, I can absolutely assure the honourable gentleman that we talk to schools, teachers, school leaders, teachers and so many within the education sector continuously on these issues, and I can reassure him that, as has been mentioned to a couple of those who've raised questions, is that we're going to eminently be sharing further information in terms of assessment in the next academic year.
Damien Hines.
Speaker, can I strongly welcome my right honourable friend's statement and this return to normality, to stability with the contingencies and safeguards that he has set out. And I wonder would he agree with me that although sometimes people talk about a balance between education objectives and health objectives, actually overwhelmingly they go together, because being in school is so important for children's mental health, as we know, but also their physical health, and indeed for some children is a safety protective factor as well.
My right honourable friend is exactly right, and the benefits to mental health, the greatest single act that we can do in supporting children in their mental health was welcoming them back into schools on the 8th of March. That was the single act that anyone could have done to help every single child. And I notice that members opposite shake their head. I mean, they probably would like the situation where maybe schools remained empty and children just remained at home. And on this side, we recognise that the beneficial effects, not just in terms of the education, but also in terms of children's welfare, are delivered by children being in school.
We now go by video link to Dame Diana Johnson.
Thank you, Madam Deputy Speaker. I know that the Secretary of State is familiar with Hull, and he knows about the educational challenges that we faced in the city before COVID. So I just want to press the Secretary of State on whether he really believes that less than 1 hour of tutoring a fortnight over the next school year is really enough to make up for the 115 days of in-school teaching children in Hull have missed this year.
Secretary of State.
Well, Madam Deputy Speaker, she's right to say that I do know Hull very well, having my family coming from Hull, and and I do recognise that there's been a great amount of challenge that schools, not just within the great city of Kingston upon Hull, face, but right across the country. And that is why our support for schools is not just about tutoring, though, as the Honourable Lady will be aware, there's actually small group tutoring. There's so much evidence to point out that it delivers some of the best educational catch-up and the best results in terms of the money invested out of any intervention. But actually there's the recovery and COVID support in terms of premium that's gone to schools, so they're able to build on further actions and further interventions that they themselves can take to support children in order to be able to catch up on the work that they've missed.
Dr. Ben Spencer.
Yeah. Thank you, Madam Deputy Speaker. And can I also welcome and thank my right honourable friend for his statement today, and thank everyone who's worked so hard, the families and the staff, to ensure that education's been delivered to children over the course of the pandemic. But can I ask him to clarify a point around the self-isolation requirements? I think, as every parent knows, children, particularly very young children, have coughs and colds to a penny and temperatures. At the moment, a temperature leads to a family self-isolation requirement, causing huge disruption for the child's education and development and impact on families. Can he unpack a bit what the requirements will be around children developing coughs and colds, particularly in early years, and what guidance and protocols will be taken forward, whether isolation will be necessary, whether testing will be necessary, or whether it can be moved over and put as just a simple cough or cold?
Well, Madam Deputy Speaker, what we'd always encourage people to do if they are poorly or ill in order to be able to remain at home, in order to be able to get better. But for clarity, those who have been in contact with someone who has had COVID, they're still able to access education, be able to come in to school. But if they've had that contact, Test and Trace would then be in touch with that individual and advise them to take a PCR test. But that individual is able to continue to attend school during that time, unless, of course, they're demonstrating symptoms of COVID. We would always advise people to self-isolate if that was the case, or, of course, they had had a positive PCR test. But other than those reasons, they were able to attend school.
Thank you, Madam Deputy Speaker. The Secretary of State for Health has told us that there will be a spike in infections following the relaxing of restrictions. And there are 150,000 school pupils currently with suspected COVID that are out of school. So we know that figure is going to go up. So this isn't about children dying of the infection, it's about schools being a vector for infection. And what is the Secretary of State going to do when the winter months are coming? we have increasing numbers of infections, to ensure that that doesn't happen by improving ventilation and assisting schools with the resources that they need in order to deliver a safer environment.
Well, I don't wish to sort of contradict the honourable gentleman, Madam Deputy Speaker, but, schools haven't been vectors of transmission. They have been reflective of the wider rates of COVID in the community, and they've been sort of reflective of that. And so we continue to, this is why we continue to have measures in place, including the testing that will be in place for schools as they return after the sort of summer period, and the continued twice-weekly testing that will run through September for children of secondary age to be taking those tests at home.
We now go by video link, or rather audio link, to Mark Harper. We don't.
Thank you very much, Madam Deputy Speaker. When schools return in
We will try to.
When schools return into September, every adult will have had the chance to be.
No, we will try to come back to the right honourable member as soon as we can. Meanwhile, Rachel Maskell.
Thank you, Madam Deputy Speaker. If you look at the data in York, infection rates are soaring, particularly in school-age children. People are poorly, and as a result of that, we're seeing major disruption in young people's education. So as we see infection rates soar across the country, it means education will be further disrupted, and I hope the Secretary of State recognises that. So how will he ensure there is effective testing put in place, working with our public health teams on the ground locally to mitigate against this spike in infections, and ensure that young people are supported and families are supported as they're having to isolate and also miss school?
Secretary of State.
Well, Madam Deputy Speaker, it is absolutely right that schools have and should continue to have a close and strong working relationships with local public health teams, not just in York, but right across the country. We have emphasised that as part of our guidance that we have issued and made available to schools, because we can recognise that we still have more to do, and the work in terms of defeating this virus will continue for past the summer and into the winter.
And now we go by video link to Nigel Mills.
Thank you. Can I welcome today's announcements? Could the Secretary of State confirm that the easing in restrictions won't affect his plans to provide high quality tutoring alongside normal education in schools?
I can absolutely reassure my honourable friend that will be the case. I mean, their high-quality tutoring and the rollout of a national tutoring programme to have a positive impact on so many is one of the absolute top priorities of this government. This is the single thing that can probably have the biggest impact in terms of helping children to catch up on the lost learning. That's why we're making such a substantial investment into it.
And now we go by video link to Emma Hardy.
Thank you, Madam Deputy Speaker. What is the government doing to prevent the chaos of last year by ensuring that all higher education students can receive both vaccinations before moving around the country to their university? And how will the Secretary of State ensure that those turning 18 late in this academic year are offered both vaccinations before they move to university?
The Honourable Lady raises an important point, and this is why we're so pleased that we've been able to say to all those who are 18 and above that they have access to a vaccination, and we are working very closely with the university sector to really get through that message about how important it is that youngsters, students are out there getting their vaccine. It not only protects themselves, but it also protects their friends, their families and their community.
Richard Graham.
Madam Deputy Speaker, having called for this in last week's debate, I warmly welcome the Education Secretary's statement today to prick the school bubbles and self-isolation system with effect from July the 19th. But could my right honourable friend just confirm the timing and whether it's entirely up to the schools themselves whether they implement any or all of these measures in the last week of term? What will happen during the summer schools, and how does the timing of this combine with his statement that children only need self-isolate if they test positive after August the 16th?
So, Madam Deputy Speaker, the Honourable Member for Gloucester asks and then it's delivered for him. So it goes to show the power of the Honourable Member. We're leaving it to the discretion of schools for the final few days of terms. We're not expecting bubble systems to be operating during summer schools, including the holiday activity and food programme. This will be purely a test and trace approach, as they currently do with the whole adult population. And as we move to the 16th of August, this will be the moment that we're able to move to the system of not having to self-isolate for children, as they were able to just go for a PCR test and get that confirmation that they don't have COVID, or if they do have COVID, then sadly they will be in a position, and understandably, where they would have to isolate.
Andrew Gwynn.
Thank you. School children have had a pretty miserable year, and COVID is a pretty miserable disease that tackles, that doesn't recognise the inequalities in society and disproportionately affects some of the poorest, most disadvantaged communities, the same communities that often need extra resource and help to get that educational attainment. So what more is the Secretary of State doing to tackle this inequality that was there before COVID but will still be there after it and exacerbated by it, to ensure that those children have the best start in life? They're our country's future. What more can we do to help them catch up and excel?
Well, the Honourable Member for Denton and Reddish and myself share that same passion to deliver that sort of change and deliver that sort of opportunity for so many children. It should never matter where you grew up. It should never matter as to what your personal circumstances. The ability for every child in this country to be able to access the world's best education, the very best opportunities, is something that I think drives us on all sides of this House. And there is, we've talked about the investment that we're making in terms of supporting children, to be helping them to be able to catch up. But we mustn't lose sight of the fact that the drive in terms of raising standards in education, making sure that there is that knowledge-rich curriculum, that we're pushing every child, no matter their background, to their absolute maximum in order for them to be able to excel and have the opportunities that every single one of us would want for our own children, we want for the nation's children, and that is where the focus will be. And we are looking forward, as we cast our eyes further to the year ahead, as to spelling out a sort of a longer plan as to where we are going to deliver this in education, ensuring that we deliver for not only his constituents but all our constituents, regardless of their background.
Felicity Buck.
Thank you, Madam Deputy Speaker. I warmly welcome my Right Honourable friend's statement today. I understand that testing will continue in secondary schools until the end of September, and at that point it will be reviewed. Can my Right Honourable friend update the House as to what criteria we will be looking at the end of September? Because I don't think any of us want to see testing in schools in perpetuity.
None of us wish to see testing in perpetuity in schools. We are, though, as the Prime Minister has at every stage set out, taking a cautious, gradual approach to ensure that as we are able to lift restrictions, we're not in a position of having to reimpose them. So we feel that this is a prudent and sensible step that needs to be taken. If there are concerns and there is a continued need in order to be able to have testing in schools, then we would of course look at doing this, because the most important thing, I think, for all of us is to ensure that schools remain open and pupils are in those schools.
Tim Farron.
Madam Deputy Speaker. Just a couple of weeks ago, I was at the Bendrick Trust Outdoor Education Centre in my constituency. It was a massive joy to be able to see residentials beginning to slowly start again and young people getting the benefits from outdoor education. But it's a reminder of two things. Thing one, 6,000 to 15,000 people working in outdoor education at the beginning of the pandemic have now lost their jobs, and because of the lack of a specific bespoke package to support those centres, there are many that have closed and many more that are on the cusp of doing so. But the other thing that it reminds us of is that our outdoor education specialists in Cumbria and around the country have a unique set of skills that we need to deploy at this very moment to encourage young people to re-engage with learning and reignite a love of learning. What will he do to specifically commission outdoor education centres to do that out in mainstream schools, and would he meet with me and some outdoor education specialists to make sure we can explain how it could be done?
Well, Madam Deputy Speaker, it's like as if his constituency neighbour, the honourable member for Barrow, and him sort of think incredibly alike. I'm sure not on absolutely everything, but certainly on this issue. And the honourable member for Barrow and Furness was meeting with myself just last week, and we're talking about this exact issue. Of course, the best thing that we can do in terms of helping those outdoor centres is making sure that their doors could open, not just to be able to welcome day visitors, but those who want to stay there on a residential basis. And we'll continue to look at what other measures we can do to support this sector. I know that the value and enrichment that comes as a result of doing so many activities, whether it's beyond Lake Windermere or so many other excellent locations around the country, bring real benefit. And I'm sure that my right honourable friend, the Minister for School Standards, would be happy to meet with him and some colleagues.
Jonathan Gullis.
Thank you, Madam Deputy Speaker, and I strongly welcome my right honourable friend's statement and the 4 schools in Stoke-on-Trent North, Kidsgrove and Talk, that received condition improvement funding, such as Golden Hill Primary Academy. But, Madam Deputy Speaker, rather than flogging the dead horse of exams, which I was going to do, I'm going to jump to a different one instead, which is let's lock off 10% of pupil premium funding. Let's make sure that funding goes into high-quality extracurricular enrichment activities, as laid out by myself previously in the House and with the Challenger Trust, who do excellent work up in Gateshead. And let's ensure that we can give those disadvantaged pupils the access to high-quality enrichment activities that many enjoy, such as the type of schools that I attended, which were private schools such as Prince College.
Well, Madam Deputy Speaker, the honourable member for Stoke-on-Trent North and Talk and Kidsgrove is a man that does like to chew a Secretary of State's ear off, especially when it comes to condition improvement funding for his schools. And it was great to see that 4 schools benefiting from his assiduous lobbying on this matter and making sure that he's delivering for his constituency. The honourable gentleman raises an important point about the use of pupil premium funding, and we do want to see schools looking at how this is more effectively targeted, especially at those pupils who are from the most disadvantaged background, especially at those pupils who need that extra support. And in the past, far too often, it's been just seen as another stream of funding going into schools, and I think we do need to get schools to be looking at how this is delivering for those pupils that it was targeted at.
And we now go by video link to Tahir Ali.
Thank you, Madam Deputy Speaker. Can the Secretary of State explain how children will access free school meals if they have to isolate away from holiday activities and food programs during this summer? And does he agree with me that a cash transfer system enabling parents to get the fund and supplies that are right for the children would actually ensure better support reaches all those that need it?
The honourable gentleman raises a valuable point, and this is why the support provided by the Department for Work and Pensions through local authorities being able to provide free school extra assistance in order to be able to ensure children are fed through the summer is such an important part of our programme, sitting alongside our holiday activity and food programme, which of course is going to be delivering not just food for so many students, but also activities, which is just as valuable.
In the hope that communications have improved in the Forest of Dean, yes, we try to go back to Mark Harper.
I'm grateful, Madam Deputy Speaker. When schools return into September, every adult will have had the chance to be vaccinated once at least, which provides the bulk of protection. So why is regular testing still going to continue, perhaps forever? Last week, the Secretary of State said he wanted to see it end. What's changed?
Well, Madam Deputy Speaker, not only do we get his voice, we get his picture as well, so enhanced in every single and possible way. Of course, we want to see schools returning to as much as normal as quickly as possible, but we have always taken the view that we need to take a cautious and careful approach, because we always want to see things being in a place where we're not having to take steps backwards. We had one of the most successful testing programmes that have ever been run in this country, that was delivered in schools on the week commencing for March the 8th, and we have seen this play an important role in terms of containing COVID and dealing with COVID, but most importantly ensuring that we can keep schools open and welcoming to pupils.
Tom Hunt.
Thank you, Madam Deputy Speaker. Whilst all these huge issues are going on, the largest teaching union in the country, the National Education Union, has said there is an urgent need to decolonise the curriculum, and how classroom layouts are in fact represent colonialism. Does my right honourable friend agree with me that actually probably more of an urgent need is for the largest teaching union in the country to finally focus on this urgent need to get kids catching up their learning, and to work, perhaps for the first time, constructively with government to try and ease these remaining restrictions?
Falstead resign.
My honourable member is a new member and arrives here with a lot of optimism, Madam Deputy Speaker. I would like to reassure my honourable friend that we have a broad and balanced and knowledge-rich curriculum that we should be very proud of, though we always work to make sure it's even better. But it is with some sadness, Madam Deputy Speaker. There's the National Education Union, first of all, started off by saying that they didn't want teachers to teach pupils in person. Then they said they didn't actually want teachers to teach students online. It starts to make you question as to whether the National Education Union really actually believes in education at all. But we will wait and see, and hopefully they'll be more cooperative and hard-working in the next academic year.
So now we go by video link to Barbara Keeley.
Thank you, Madam Deputy Speaker. Regular testing for pupils and staff is going to be a vital part of stopping the spread of COVID-19. But the decline in testing numbers shows that home testing currently isn't working well. Tackling this with on-site testing would mean some schools in my constituency having to test 600 children a day, which they tell me they simply don't have the resources to do. Will the Secretary of State give schools the resources they need, including external support if they need it, to make sure they're able to carry out testing and keep children safe?
I would like to reassure the Honourable Lady that we will be supporting schools as they roll out the testing. Schools have delivered the asymptomatic testing on school premises incredibly successfully already in this academic year, and we'll look at providing the same level of support to schools as we did earlier on in March, and we have every confidence that we're able to deliver that right across the country.
James Wild.
Thank you, Madam Deputy Speaker. I welcome these changes that will mean that healthy pupils can spend more time in the classroom. And following my recent visit to Ashwickham Primary School, can I urge my right honourable friend to ensure, as part of the recovery plan and with an eye to the spending review, that schools get the special educational needs funding that is required now more than ever, so that every child's needs are met.
Secretary of State.
Well, I know that my right honourable friend is a great champion for not only his schools and his constituency, but also children with special educational needs, where we all have a very shared passion to do more for. He's tempting me into sort of public discussions with Her Majesty's Treasury, maybe a sort of over the dispatch box straight to the Chancellor. While I'm tempted and he's desperately trying to lure me down that path, I'm going to decline on this occasion to sort of enter that public discourse. But of course, children with special educational needs are a top priority for us. I would certainly be expecting that is properly reflected in any future settlements.
Chilmore.
Thank you, Madam Deputy Speaker, and I welcome the end of mandatory bubble isolation, which has caused such disruption to parents, teachers and children. But the impact of COVID continues and the poorest are hardest hit. Over the last 5 years, child poverty in Newcastle Central has risen by 13 percentage points to 45%, 6 times the national average increase. So what additional support can children in Newcastle Central expect, apart from the catch-up plan, which the government's own Educational Recovery Commissioner described as feeble?
Well, Madam Deputy Speaker, one of the things that we can do to best help all children across the country is the continued drive to raise standards across our schools. Of course, she sort of dismisses over £3 billion investment that we've made. But this is an important investment targeted at the interventions that will deliver the biggest benefit to her constituents.
Steve Bryan.
Thanks. Last Monday I made clear my view and those of many in my constituency, the unfairness of the bubble system and the consequential isolation, so I welcome today's confirmation. But isn't it the case that sending the whole bubble home because of one positive case is no more necessary now than outdoor sports days being cancelled or held behind closed doors, or end of term events being ruined, things that we never get back? How can the Secretary of State and his team help colleagues across all educational settings feel supported to get the balance right come the new term?
Secretary of State.
Well, my honourable friend picks upon the issue of sports days, and let's be absolutely clear, the guidance is absolutely there in black and white, saying sports days can proceed. Parents should be able to attend, and we really encourage schools to be able to do that, because he rightly points out these are things that you can't get back. So this is why we wanted to be able to lift those restrictions at the very earliest possible moment. If members, and I know my honourable friend is familiar with his regional schools commissioner, if there are challenges, having that local dialogue with regional school commissioner teams are an important part if they are having challenges in terms of dealing with their school directly.
Sarah Owen.
Thank you, Madam Deputy Speaker. Early years and nurseries, like the fantastic Grasmere Nursery in Luton North that I had the pleasure of visiting recently, are a vital part of our education system. While primary and secondary schools have had some of their COVID costs compensated, nurseries have not had a single penny of costs incurred during the pandemic reimbursed. Why are nurseries always an afterthought for this government? And will this unfairness be rectified? And if not, why not?
I'm sure the Grasmere Nursery is reflective of many nurseries right around the country that actually had the sort of benefit of being funded at pre-COVID levels, and we carried on that level of funding, recognising the fact that they were operating in truly exceptional times.
So no then.
Greg Smith.
Thank you, Madam Deputy Speaker. I warmly welcome my right honourable friend's statement and the step back to normality and letting children be children that the scrapping of the bubble system brings. But there continues to be an anxiety that affects people on both sides of this particular debate, and that is whether the vaccination programme will be extended into those under 18 years of age. So can I ask my right honourable friend to redouble his efforts to work with colleagues in the Department for Health and Social Care so that we can push the JCVI to come forward with their recommendations, so one way or the other a decision can be made that takes away that additional anxiety from young people?
My honourable friend is right to highlight the important nature to ensure that we have the correct and best information to inform decisions on the matter of vaccination of children. It is my hope that JCVI will be forthcoming imminently with their report, and that will obviously inform decisions that government makes very much in the best interest of all our children.
And finally, Liz Twist.
Thank you, Madam Deputy Speaker. For many months now, school leaders have been spending a lot of their time on weekends making contacts where they're notified of someone having COVID-19. So I'm glad to say that some of that responsibility will be shifted to NHS Test and Trace. But can the Secretary of State just clarify exactly what that relationship will be, given the references to settings still having a role to play in that situation?
Secretary of State.
Of course, and the Honourable lady is right to highlight the amazing and important role that schools, head teachers, the whole education team have played in terms of supporting the efforts on test and trace. We expect the contacting to shift from schools having to do it to shifting to test and trace to do it. But of course there will still be contact and information that will sometimes be asked of schools. But we don't imagine that the current burdens that schools have to face will be, we see this being scaled back considerably, very much to head teachers and teachers' benefit.
Thank you.
Point of order.
Point of order. Mark Tammy.
Thank you, Madam Deputy Speaker. On Friday, the Secretary of State for International Trade visited Airbus at Broughton in my seat. Her office gave me 14 minutes notice before the meeting was due to take place. 14 minutes, Madam Deputy Speaker. I just wonder what she can advise we can do to ensure that the rules that apply to the rest of us also apply to government ministers.
Well, I thank the Honourable Gentleman for having given me notice that he intended to raise this point of order, and I can say very simply and in a straightforward way that such behaviour by a minister, or indeed any member, is wrong. Just quite simply wrong. Members may not be aware because things have not been operating normally here this last year and a bit. There is a little booklet called Rules of Behaviour and Courtesies in the House of Commons. I seriously advise everybody to look at this little booklet. It's not some ancient tome hidden away in the library about the way in which things work here in this ancient parliament. It's bang up to date, and it says quite clearly, on a matter of courtesy between one member and another, that you should notify colleagues whenever you intend to visit a colleague's constituency, except of course on purely private visits. And I take it that the Honourable Gentleman is certain that this was not a private visit. I take it that the Honourable Gentleman has informed the Right Honourable Lady to whom he refers.
I have.
Excellent, that he intended to raise this point of order. Then she will be aware of the situation. And I can simply say to all members that it says in this booklet, and Mr. Speaker takes this very seriously, failing to inform colleagues of your intention to visit their constituency is regarded as very discourteous. And that's what I can say to the Honourable Gentleman now. It is discourteous for a minister to behave in this fashion. I'm quite sure that an apology will be forthcoming. Point of order, Stephanie Peacock.
Thank you, Madam Deputy Speaker. Yesterday, the government rejected the cross-party proposals from the Business Select Committee into the Mine Workers Pension Scheme. Can I ask through you, Madam Deputy Speaker, whether the government will come to this chamber and give a statement and explain their disgraceful decision to continue to take billions of pounds from the pockets of retired miners?
I thank the Honourable Lady for her point of order and for having told me she intended to raise this point of order. I'm not at all surprised, as I've heard her speak many, many times about this subject with passion here in this chamber. The Honourable Lady will know, of course, that the decision of ministers to whether or not to come to the House to make an announcement or to respond to a report is not a matter for the Chair, but I can advise the Honourable Lady that there are various ways in which the Table Office will be able to advise her that she might endeavour to bring a minister here to the Chamber to answer the questions which clearly to her and to her constituents are important questions. Thank you. I will now suspend the House for 3 minutes in order that arrangements can be made for the next item of business. Order!